800,000 Canadians are on a waiting list for surgery. The average wait time between primary care and physicians in Canada, and specialists rather, is 9 weeks. In this country, in 1997, we introduced 100 new disease-fighting drugs. And everybody likes to throw rocks at the pharmaceutical companies, including, unfortunately, Senator McCain in some cases. But they like to throw rocks at pharmaceutical companies. They make too much money. They do this, they do that, they do something else. We introduced 100 new drug-fighting drugs in this country in 1997. Do you know how many of those are available in Canada in that year? 43, less than half. One particular drug, Rituxan, which is very, very effective in fighting Hodgkin's lymphoma, is not available in Canada because the Canadians control what drugs can be released in their country and what drugs can't. 97% of all the new drugs released in the world are developed right here in this country because of the R&D, the research and development that goes on, and the money that it takes to do these. You know, we hear about the Lipitors and all the drugs that we hear that they make a fortune on. What you don't hear is that out of 100, maybe 93% of them don't make it through trials. Okay? And so all this money goes into this, and yes, they hit a home run every once in a while, but they hit a lot more that aren't home runs. Okay? So when you hear that issue, understand that what's going to happen with universal health care, the other thing that will happen is we will lose all of these magnificent new drugs we see coming on the market, a lot of them, especially the new designer chemotherapy drugs, the new genetically designed drugs that are going to stop cancers, and a lot of the other things that are going on. There's some huge breakthroughs out there. Those breakthroughs won't continue if we move to universal health care. So what happens with universal health care? Well, you've got planned wait times. As I said, you have to control access because you can't control cost. Okay, you get in the queue, and they tell you when you're going to be able to have care. I had a woman in my office about 3 weeks ago who had just come back from Spain, and she was a native of Overland Park. She was a very highly paid executive, and she was married to a Spaniard, and she brought the whole family back to Overland Park, and she's going to live here now. And I couldn't resist asking her, can you tell me what you thought of the Spanish healthcare system? And she said, it's horrible. I said, well, what do you mean it's horrible? She said, well, they call you and tell you when you can go to the doctor, and I don't care if it's in the middle of the day. I don't care if you've got a business meeting. Whatever you have to do, you leave and you go to the doctor. And you go when they tell you you're going to go. And then you wait for 2 to 3 hours to see a doctor. That's how it works. Okay? And she told me, well, I said, but that's the nickel-dime stuff. That's the going to the doctor, the regular thing you may have to deal with. But when you get to the serious issues like cancer, those kinds of things, they've got a good system, don't they? I mean, I'm thinking that's what we always hear, is that they've got great systems in these countries for dealing with the really significant issues. She said, well, my father-in-law was 72 years old, and he was diagnosed with cancer. And they gave him his morphine, and they told him to go home. And they didn't treat him. But they did buy him a nice bed, and he was allowed to die in that bed, and then the state came and got it and took it back. But he had the bed in his home while he was waiting to die. Okay? That's how the system works. And I said, well, I don't understand. Why do people put up with this? I mean, don't they understand that what they're getting is substandard care? And you know that's a question I get a lot when I do this, when I have this conversation or give this talk, is that, well, you don't hear people complaining in these countries about it. Do you know why? Because they're conditioned to accept it because it's behaviorally what they've grown up with. That's why, okay? And because have you ever seen a government program that once it's in place is repealed? The answer to that question is no. Okay? So that's why we don't hear a lot about this in these other countries. They're conditioned to it. She told me when people get cancer in Spain, for the most part, they just assume it's over. That's part of the deal. That's the way it works. So they're conditioned to accept that that's what's going to occur. So let's move on to what the politicians want to do. Let's talk about Hillary and Mr. Obama. Okay? Both of them want a single-payer system. Mr. Obama uses a series of smoke and mirrors to talk about a national health exchange or health care exchange. It's really a super agency that's going to step in and take over health care. That's what he wants to do. He wants to regulate health insurance, and what Hillary Clinton very clearly wants, and she stated it and made it very clear, is a single-payer system. Well, there's one in the United States that's working right now. It's in Massachusetts. It's called the Massachusetts Connector. And according to the New York Times, not exactly a right-wing organ, if you ever read the New York Times, it's failing. Okay? And what's happening is, A, they can't fund it, and B, it's not working. Okay? They don't have enough physicians. They can't get people in. The average wait time to get an appointment to see a doctor for a physical now is in 2009. Okay? That's what they're talking about. That's how short they are on physicians because of the situation they've got. If you do not buy health insurance on the Massachusetts connector where the state controls the plans, there are three plans, Harvard, Pilgrim, Blue Cross and Blue Shield, and one other company, which I cannot remember the name of. Those are the three plans available. They're not available everywhere in the state. They're available in certain counties. Okay? They control access. The state decides what it's going to be. If you don't buy it, everybody is forced to buy it. That's what Ms. Clinton wants to put in place. Then they penalize you. The average penalty for an individual person last year was $219 in personal tax exemption you lost. The penalty of the fine was $912, and if you're a couple, the fine was $1,814. So Big Brother has come in, and if you don't buy this policy we're telling you have to buy, then we're going to penalize you. Okay? Businesses were penalized even more than that. 748 employers, $6.6 million if you chose, in penalties, if you chose not to provide health insurance. So if you're a small business and you either don't want to do it or you're giving your people a stipend to buy individual policies, whatever the case may be, they're going to come in and they're going to tell you that you have to do this. Now, why did they do this? What's the philosophy behind this Massachusetts connector? The philosophy is that if we get the people between 25 and 35, remember that 44,000 to 74,000 that don't buy health insurance? Well, if we bring them into the system and force them to buy health insurance, they'll subsidize me. I'm the 58-year-old guy that's got the higher premium, so if we drag these 30-year-old people in, that's going to work. Well, actually, it's not. About a month ago, I had a young man in my office in Boston College who lives here in Overland Park, and he had heard the radio show. And he came in to see me, and he had the Massachusetts connector, and he brought it with him. He was paying $306 a month for a plan that had no pharmaceutical benefit whatsoever, a limited benefit for doctor office copay, all right, and no emergency room benefit. I wrote him a Coventry One policy for $80. It had full pharmaceutical benefit, full first-dollar emergency room coverage, unlimited doctor visits, the whole 9 yards, and a deductible that was lower than what he had. Okay? Private sector versus government run. It simply doesn't work, ladies and gentlemen. It's not going to work. It's a train wreck if it comes. Okay? So what Mr. Obama wants is he wants to have a national health exchange, and he wants to model it after what they're doing in Minnesota. Now, he's flip-flopped on this because I have recordings of him talking when he was a senator, a state senator from Illinois, about a single-payer system, but he's kind of moved away from that now, and he's talking about this national health care exchange. Okay? And what he wants to do is he's going to highly regulate what goes on with health insurance in this country. So he's going to follow a model they have in Minnesota. Been hugely successful in Minnesota. They tell insurance companies out of every dollar you can keep so many cents. So let's say you can keep 10 cents and 90% has to go back into your policyholder. Sounds good. Well, there's one problem. They're down to 3 carriers in Minnesota. The largest carrier in the country, United Healthcare, is headquartered in Minnesota. Guess where they don't offer health insurance? Minnesota. Okay? You can't make this work through government regulation. If you can give me the name of the government program that you'd like to emulate national health care after, I'd like to hear what it is. Okay? Maybe it would be our education system. Maybe it would be Medicare. Okay? It's not there. The other